right, this last little section. So this is about health, nervous system, kind of how all this ties together. Because, I mean, you can eat all the best food you want, but if your brain can't talk to your body, if you're exercising 6 times a day, but your brain's not able to tell the body how to work, then it really doesn't matter. So this was done by Dr. Roger Sperry. He won the Nobel Prize in 1981 for physics, physical medicine, and physiology. Were the two things. But 90% of the stimulation and nutrition to the brain is generated by the movement of the spine. So basically, if your spine doesn't move, your brain starves. So you got to move your spine. That's why they're seeing like a correlation. They're calling sitting the new smoking. You've heard that? Some people heard that? Sitting is the new smoking because you're seeing some of the same cardiovascular and pulmonary and Alzheimer's and all these diseases that we used to get from smoking. Now we're actually getting from sitting because our bodies are shutting down. And a lot of you guys are patients. You've already signed up. You're here. I'd rather have, I don't want you to be here and not know why you're here. Like, I used to think chiropractic was just about stiff necks and sore backs, and that was pretty much it. If your neck hurt, you get adjusted, and that's kind of the whole deal. But that's really not what we do, especially not what we do here. Our goal is correction. We want to get your spine into a healthy condition and healthy shape so that not only do we get rid of whatever pain symptoms you're having now, but we can keep that from coming back in the future. And then the bigger picture with this is to keep your nervous system working right, because your brain is talking to your body through the spine and nerves. So if those things work right, then your body works right. It's just that basic. This is the side view of the neck. So we're looking like this way. The neck should have a forward curve to it. Nice disc spacing. Beautiful discs, no degeneration, no arthritis. We call that curve the arc of life because that curve is housing your spinal cord. Hold your hand like that. So your spinal cord is like the mushy part of your hand. It's like soft and loose and mushy. When you lose the curve in your neck, which we'll show you, it actually stretches the spinal cord. And the weight of your head weighs as much as a bowling ball. Some people more than a bowling ball. So when you have a curve in your neck, it's like having a spring, so it bounces your head up and down. When you lose the curve in your neck, your head is basically jamming down those lower joints and lower part of the spine, and that's what happens when the neck gets out of alignment. So you see a nice, beautiful curve, and then they have a whiplash or a trauma or a car wreck or whatever, and then the first thing that happens is you lose the curve. That usually takes about a decade or so. It's about a 10 to 15-year process. And then if you take a look at this disc here, and the one down here, you start to notice that the discs will begin to collapse. This one's nice and big. These get smaller. And the next thing your body does is it treats the spine like a broken bone. So you'll start to see all the formation of these bone spurs, degeneration, osteophytes, calcium deposits, whatever you want to call that. The body is essentially treating an unstable spine like a broken bone. So when things get out of position, your body literally treats it like a broken bone. So you heard of someone that has arthritis in their neck or arthritis in their back. It's not old age. It's misalignment plus time. Like it's predictable. It happens every time. If my left knee is out of alignment and my right knee is in alignment, which one wears out first? The one that's out of alignment. Is it just old age? Well, how old is my other knee that's fine? Right? So it's not old age, right? It's misalignment plus time. But the problem is we live in a drug-based healthcare system where you wait till things fall apart and get painful, and then we go to the doctor and they give you pills. And if the pills don't work, then you have surgery. Like that's the healthcare. So we call that, it's really sick care. So nothing about that is really health-related. And again, I'm not against drugs, but it's not the system that's going to keep you well. It's diet, it's exercise, it's minimizing toxins, it's taking control over your own health and keeping your nervous system healthy. So chiropractic is based on 4 simple principles. This is so ridiculously simple. The body is self-healing. I played basketball on Saturday and got this nice scratch. Turns out that's the only way they can stop me on the basketball floor is they got to use their nails. No, actually, my vertical leap is like, you can't even slide a quarter under my feet. But anyway, so I got scratched. So I've done nothing to that cut. It happened on Saturday. What's it going to do? It's going to heal. Sometimes or always. Almost seems ridiculous, right? Did I have to put Neosporin on it? Did I have to put a Band-Aid on it? No, it just heals itself. And your body does that all the time. It heals cuts, it heals a sprained ankle, it heals the cold, and your body's fighting cancer. As you're sitting in this chair, your body's actually fighting off cancer cells. It's amazing, unbelievable. God's creation blows me away. The more I learn about it, the more I'm amazed. It's just the way we're designed is we're designed to self-heal. The nervous system controls all aspects of the human experience, and it controls every aspect of your health. Here's the question. If I cut my head off, would that keep healing? No. Is that a belief or a fact? Fact. You cut someone's head off, their cuts don't keep healing. It kind of stops immediately, right? Well, what if I cut the nerve in my neck that leaves my neck? What if I was to cut the nerve that just controls my arm? Would the cut keep healing? No. If the nerve can't tell the immune system where to go, if the nerve can't tell the blood clotting factors where to go, if the nerve can't tell all the little soldiers that do the healing, if it can't tell them where to go, then healing doesn't happen. And yes, there's blood flow, and yes, there's everything else, but that's controlled by the nerves. So that's really the name of the game with this. The third thing, interference to the nervous system sabotages health and life, because your health is your life. So if you damage the nervous system, you damage the way your body heals and functions. It's very, very simple. Our job, very simply, is to remove interference to the nervous system. So when you come in, we're not treating your neck pain or your headaches or your backache or your sore shoulder or your whatever. We're reducing interference to the nervous system by getting the spine into a better position. And great, fantastic, your back feels better, I love it, awesome, high five, praise God. But that ain't what we're doing. We're removing interference. That's the name of the game. And symptoms are just the oil light. The symptoms you feel, the pain you're in, the symptoms you experience is just the smoke detector in the house. It ain't the problem. So if you just want to treat symptoms, it's like taking duct tape and putting it over the oil light or taking the batteries out of the smoke detector. That's basically what drugs do. They cover up symptoms. And again, I get it for certain things. I got to have certain drugs, but the reality is most symptoms are just warning signs.